doing cervical decompression, protocol 1, protocol 2. So patient's face down. We're gonna lower it down. Are you comfortable with the head that low, or is that too low for you?
Oh, that's good.
Okay, so we wanna have the head dead smack in the middle of that cushion. If they're too low, their chin is gonna be off the cushion, and all of a sudden those straps are not as effective as they could be. So we wanna let the patient know, I'm gonna place some straps over your neck. It's gonna restrain you a little bit. Can you breathe okay in the paper?
Yes.
Okay, let me know if you have any problems at all with this. 5% of people have some claustrophobia, and they're not gonna like this. So if that happens, take them off, flip them over, do supine traction. You can use a towel or you can use your hands as a variation for this. Okay, so you comfortable? Ready to go?
Yes.
All right, so both hands moving simultaneously, okay, the whole time. Good, strong contact. Your hand should be tired, okay, after doing this. Let me know when you feel a good stretch.
Okay.
Right about there?
Yep.
So always checking in with the patient, making sure you're in their comfort zone, that they're feeling it. If I push too hard with my front hand, it's going to put them into hyperextension. It's going to traction their face on the paper and give them a traction burn. So if I push too hard with my other hand, it's just going to drive their face into the cushion. So it's both simultaneously. And I'm using my back leg to push, to drive me forward. So I'm more using my legs than I am using my arms with this. For other patients who are really, have less tension in their spine, you could just, you can stand there and really just use your triceps, but many patients have a lot of rigidity in their spine and need more of a push. Does that feel okay?
Yeah.
Okay, good. And then we'll switch over to protocol 2, which will start kind of with upper thoracic mobilization. Okay, and then we'll go with true protocol 2 with the contact. Lifting up. I'm taking this hand, I'm lifting straight up. Squeezing and lifting up. Does that feel okay?
Yes.
Does it feel like it's opening up for you?
Yeah.
Okay. So again, just like in the lumbar spine, you're decompressing nerve roots, you're opening up the foramen by 25%, increasing blood flow to the nerves, centralizing herniated discs and bulging discs by creating a centrifugal force inside the disc, and mobilizing the facet joints. Does that feel okay?
Yep.
Okay. Lock the table, give it a little click into place. I usually unstrap the patient before I click it back in the y-axis direction, because it'll force them into flexion and can irritate the disc that you just decompressed. Okay, all done. All right, let's have you flip over on your back next, please, Kim.
Okay.
We have a ton of new people joining our organization, new doctors, new staff, and so it's like I got to kind of keep up on the training here. Is that okay, Lou? Appreciate you letting me do this.
No problem.
Okay, we got cervical spine adjusting 101 here. I'm going to just zoom in on your adjustment, if that's okay with you.
Uh-huh.
Okay guys, we're doing a cervical adjustment. The key with this is the patient is relaxed, okay? So this patient, she's been adjusted many times, but for somebody who's really nervous, I'll treat her like she was nervous, okay? So Mrs. Jones, we're gonna be doing a little adjustment on your neck. Okay, you're Mrs. Jones today.
Okay.
And you're gonna feel some pops and clicks. Is that okay with you?
That's okay.
All right, so we have the patient's verbal approval to do the adjustment. So we're gonna set her up. Okay, we're just gonna turn the head and let it rest right there. But she's just kind of in my hand here, just kind of rocking, real relaxed. I always give it the little rock test to make sure she's relaxed. I kind of shake it a little bit, and I can tell she's not guarding, she's not holding up, she's not nervous at all. But if she was, I would say, okay, Mrs. Jones, relax that neck. I'm just going to give you a little shake, and I just spring through this other hand, just test it out, see if her body wants to clench. I mean, she's not, but if she was, I'd wiggle, wiggle, wiggle until I felt she was ready, and then I would sneak it in there with her knowing that I'm going to do it. So Mrs. Jones, I'm going to give you a little adjustment. Are you ready?
Yes.
Okay, we're just going to give it a little shake. Just let everything relax. And that's it. So her head is only moving, half of an inch from here to here. The shake loosens up the muscles so that the bones are much more mobile, and you just give it a tiny little movement, okay? From the other side, same process. Let the head rest on the cushion, Mrs. Jones. We're just going to give it a little shake. Okay, she's nice and relaxed. I'm going to come right from my center point, and it's just going to be a quick little pec twitch like this. All right, are you ready?
Yes.
Okay, here we go. And that's it. Okay, so my hands look like this, bink, bink, like that, bink, like that. You're just turning a little bit. And very little movement of the head into rotations. You're protecting those vertebral arteries, protecting the fibers of the disc, the Sharpie's fibers, and avoiding any over-rotation that could sprain facet joints and interspinous ligaments. Okay, good. All done. All right, next up. Okay, we're going to be adjusting this patient's thoracic spine. So can I have you slide your body down the table a little bit lower for me?
Absolutely.
I want T1 right on that top of that thoracic cushion. Good, and I was just kind of give it a little feel. Feels perfect. Okay, we're going to have you crisscross your arms, give yourself a big hug. Comfy? Are your shoulders in good shape?
Yes.
If I push on your shoulders, does that hurt you at all?
No.
So I just check the shoulders, make sure there's no torn rotator cuffs or capsular injuries or arthritic joints. And if there was, I'd take that painful arm, I'd bring it down, put it on their belly button to take that shoulder out of the equation, and then I'd proceed to work through just an anterior adjustment through the one arm. Okay? So we'll crisscross them. Okay, I'm going to put my hand behind you like a fulcrum. I'm going to adjust you right over my hand, okay?
Okay.
All right, I'm going to be giving you kind of a little bit of a hug. All right, are you ready?
Yes.
Okay, so just roll this way a little bit. Take a big inhale and a full exhale for me. All the air out. And I do a little circular movement with her to, almost like I was adjusting the neck. We kind of circle the body to loosen up the muscles, and then we just give a quick little upper body drop, like that. Okay, we move the hand down a little bit, do the same kind of thing, and that's it. And if we get cavitation, great. If we don't get cavitation, and there's kind of like a soft end feel to it, I'm not worried about it. If it feels like it's a really hard end feel, I'm not going to push it. I'm not going to do a second one. In her case, it felt like the muscles are so tight. We got some good movement, like a mobilization, but it wasn't a audible cavitation. Okay, we doing okay?
Yes.
All right, great. Good job. I'm gonna stand up, move around a little bit. So patient gets up off the table, we're all done. Okay, Mrs. Jones, I just want you to move around a little bit, make sure everything feels good, see if there's any spots that still need some attention.
Oh, feels good.
Great. So normally we would just check the patient's chart. We would say, okay, Mrs. Jones, I see you're scheduled for a follow-up appointment tomorrow. I'll see you tomorrow, or I don't have you scheduled for a follow-up. Please see the front desk and they'll get you all squared away. I would like to see you 3 times a week for the next 3 weeks, or whatever the treatment plan would be. Cool.
Very good.
All done. You're the best.